Good evening, everyone. I'm really delighted to be here. I'm part of the Capitol Health Behavioral Health Specialist team of clinicians. And today I'd like to share with you some strategies for maximizing brain health and decreasing your chances of cognitive decline. All right, first I want to just start by saying that I have no financial interest or affiliation concerning the material discussed in this presentation. And today, we're going to learn a number of evidence-based strategies to improve brain health, recognize the difference between cognitive changes related to normal aging versus dementia, and also understand the benefits of meditation and mindfulness for brain health. Okay, so Capitol Health Behavioral Health Specialist has an office in Bordentown, New Jersey, and also an office in Newtown, Pennsylvania. And so we're a group of psychiatrists, nurse practitioners, psychologists, therapists, and nurses who provide diagnostic evaluations, ongoing medication management, TMS, which is really a non-invasive technique that can be useful for individuals with resistant depression, various types of both individual and group therapy, and case management for those with behavioral health issues. Okay, so all of us worry about memory loss at one time or another. Just the other day, actually, I was talking to my son, and he was as I was talking to him, I was trying to recall some common word, and I couldn't come up with it right away. And maybe because I was thinking about this presentation or whatever, I just almost reflexively thought, am I getting dementia? And so I think I knew the thought was kind of crazy, but it's a automatic thought I got anyway. And so I find that many actually of my patients also worry about memory loss and the dreaded D disease, dementia. But the good news is that we can take steps to reduce the chances of cognitive decline and dementia with strategies we will review in our presentation today. So first, let's relax. It's normal to forget things. It's normal to forget things and to be more forgetful as we age, and our memories are not perfect. First, just briefly review the short-term memory versus long-term memory. The short-term memory is present for minutes, seconds, etc. It's something that can be easily disrupted with interruption. For example, let's say that I'm trying to make a call, remembering the 7-digit phone number, or of trying to call a restaurant. So I dial that in, and if my spouse says, honey, what do you want for dinner? I'm going to be disrupted in terms of that, and may have to kind of look up that number again. And I'll tell her, no, I'm going to order from the restaurant. So anyway, but long-term memory is something that's stored away for recall later. And some long-term memory are like, for example, the town that we live in. And those are enduring memories. So even if you're interrupted by your spouse, you're going to remember what town you live in. There are two types of these long-term memories. One is factual kinds of memories that, for example, the name of your best friend or something like that, or your birthday. And certain skills, like how to drive a car, how to make coffee in the morning, these kinds of things are also a type of long-term memory. So the mind, because the mind and the body are connected, many of the interventions that we're going to be talking about today will also be ones that promote a healthy body. So the Alzheimer's Association has come up with some essential ingredients for brain health, and including, for example, regular exercise, stress reduction, eating healthy, getting enough sleep, staying mentally active. And then there's some additional ingredients for brain health that we're going to be talking about today, including maintaining a healthy weight, staying socially connected, managing medical conditions, etc., avoiding head trauma, treating mental illness, especially depression, and treating hearing or vision problems. So I want to start by talking about the importance of exercise. Um, Exercise does so many good things to our body. It in such as bolstering the immune response. It also blunts our cortisol production, which is a stress hormone. Some good things are released when we exercise, such as endorphins and serotonin. It improves things such as sleep, helps improve, for example, insulin efficiency. But for our purposes, the most important thing is that it decreases the chance of developing dementia. So there was a study of about 191 women over 44 years, which showed that women with high fitness in midlife had an 88% less chance of developing dementia and delayed the onset of dementia by 11 years. So, and another study, those who walked at least 3,800 steps, you don't have to necessarily walk 10,000 steps, had a 25% lower risk of dementia. Also remember that it's just not exercise, but it's the long periods of sitting that may contribute to cognitive decline. So get up and move throughout the day. One of the things that I do is that I go to our waiting room to greet our patients, bring them in. This way I get up and they know exactly where I am. They come to the office. After meeting with them, I take them back to the front desk, meet with the receptionist to make their follow-up appointment, etc. And so some of this stuff actually I don't need to do, but I do purposely because that allows me to also move about throughout the day rather than just sit at my desk. Okay. So the contributions of exercise to the brain are really profound. It increases brain volume, increases the size of our hippocampus, decreases, age-related brain changes, and again, it reduces the chance of dementia and delay onset of dementia. So in terms of exercise, we've heard, we all have heard of that, we should be exercising optimally about 150 minutes of moderate intensity exercise a week or 75 minutes of vigorous exercise. But any kind of exercise is better than none, of course. Well, another benefit of exercise is that studies have shown that it has an antidepressant effect. And those engaging in exercise showed a decrease in depression on validated rating scales. And this may be related to the exercise, the benefits of exercise in terms of, again, we talked about serotonin and endorphins. And as you know, serotonin is one of the important neurotransmitters in the brain that may be diminished in depression. And some of our key agents, medications that we use to help with depression are, as you know, called the SSRIs, the selective serotonin reuptake inhibitors, which actually increase the serotonin in our body. Interestingly, even, it's been found that yoga may be as effective exercise in improving both physical and mental health. And our thought is that the way that yoga does that is that it essentially activates our parasympathetic nervous system. This is our rest and digest system. And as opposed to the sympathetic nervous system, which is our fight and flight system. Because of the benefits on that may be one of the reasons that yoga may be helpful. So what I'm going to do is I'm going to just jump right into reducing stress with you by us doing a short deep breathing exercise. Our minds and bodies are connected, often disconnected, and the breath brings them into connection. So our mind is often stuck in the past in terms of past regrets or maybe in the future worries. And we rarely find ourselves in the present moment. And really, when you think about it, the present moment is all that we really have. And so when we breathe consciously, we bring ourselves into the present moment. So what we're going to do now is that if you'll join me, is that we can take 5 deep abdominal breaths. And abdominal breathing is the way that babies breathe. We've kind of forgotten that as we get older and we do this kind of shallow chest breathing. So why don't we, at this point, if you're comfortable, maybe close your eyes, or you can keep them half open. And I want you to just take 5 deep breaths in and out, watching the belly rise with the inhalation and fall with the exhalation. So I'm going to do this with you. Okay. So this is one of the things that I'm actually trying to put into practice, and doing this kind of a short thing every hour or so. So kind of recentering myself. A lot of our smartwatches have these kinds of functions which, tell you to breathe every. You can set it so that it reminds you to breathe every hour or something like that. And you can certainly do that with your smartwatch if you have that function. Okay. Now, stress, the reason we're talking about stress is because it has an impact on the brain. Okay, so I just wanted to remind you about that. So the thing is that stress is really a bodily or mental tension resulting from factors that tend to alter an existing equilibrium. At least that's what Merriam-Webster tells us. And so imagine you're going to work in the morning and you're stopped at the red light and somebody rear-ends you. What you've just experienced is a disturbance in your equilibrium. And this is stress. And so the thing is that how we respond to the stress can make all the difference in what kind of day we're going to have. We can get out of the car, curse the other person out, or we can get out of the or take these 5 deep breaths or something like that before we get out of the car, and in a friendly manner approach the person who hit us, and get all the necessary information, the license plate, the insurance information, do all that. But doing it in this way could make an entire difference in your stress level the rest of the day. Okay, so our stress response system, not to go into any detail, but is really a complex interaction of various symptoms: endocrine, immune, and nervous system. About 2/3 of the primary care visits are for stress-related conditions. And aging itself does a double whammy on us by increasing the stress hormone called cortisol. So, and cortisol is associated with poorer cognitive performance, and it affects and shrinkage of areas of the brain associated with memory. So that's why it's also important to reduce our stress and manage it. Now, stress affects all major systems of our body, and may aggravate or precipitate illness. You may end up having illnesses you would have otherwise been able to prevent if you had been able to manage your stress. And it's also an important component often of depression and anxiety, which again increases our cognitive impairment. Our body was really is very well suited to handle acute stress, but not so well suited to handle chronic stress. And acute stress is like that example of being rear-ended, or being pulled over by a cop for speeding, or having a deadline at work, and the stress of that. moving, etc. Chronic stress is maybe chronic health problems that we may have, being in a job that you don't like or is toxic, maybe having financial difficulties at home, etc. Being in a stressful relationship. So these are the kinds of uh, chronic stresses. Now, to drive the point home further, imagine that you have a bucket of water and you pour it on the ground. You pour it on the ground, and if you wait, the water will absorb into the ground and it'll dry up. But imagine if you had a steady trickle of water, and so there's no time for the ground to dry up the water, and you may have a wearable pond of water. So this is the analogy between acute stress, the bucket of water, and the chronic stress, the slow trickle, which can be dangerous. Now, let's talk about inflammation, because like the story of acute stress and chronic stress, we have the story of acute inflammation and chronic inflammation. Acute inflammation is helpful to get rid of infection. It's for example, if you have a cut or any kind of a wound, the body mobilizes resources to get rid of that infection. But it's chronic inflammation that causes cellular and tissue damage. And chronic inflammation is often something that contributes to various kinds of health conditions, such as heart disease, cancer, diabetes, itis diseases like colitis, arthritis, and for our purposes, it also contributes to things such as Alzheimer's. So two-thirds, not surprising, two-thirds of the women, two-thirds of individuals with Alzheimer's are women. And we may just think that that may be because of the fact that they live longer. But women actually also, after menopause, have an overly increased immune response that may cause amyloid plaque deposits, and also decrease ovarian hormone estradiol, which may affect memory. So again, chronic inflammation can be fueled by a poor diet, lack of sleep, lack of exercise, ongoing stress. These are the kinds of things that can fuel chronic inflammation, which can then affect our cognition. But we have things we can do to address these things and to be proactive. A diet is one of major ways that we can address this. There are things that we eat that are pro-inflammatory, and there are things that we eat that are anti-inflammatory. This is something that you're familiar with, such as when people say don't eat high kind of carbohydrate foods or saturated fats or sugary foods, sugary drinks, processed meat, etc. These are all because they're all pro-inflammatory. Anti-inflammatory is all those kinds of things that we've been told to eat, which we sometimes don't, such as leafy green vegetables, colorful fruits, vegetables, nuts, olive oil, fatty fish, whole grains, things like that. These are anti-inflammatory. And the anti-inflammatory foods also promote a healthier, more diverse gut microbiome. That's just a fancy word for meaning the mix of microbes in your gut. And so there's some evidence that those individuals with a healthier microbiome from high fiber foods such as and probiotic foods such as yogurt may actually live longer. And also, exercise also promotes a microbiome diversity by reducing inflammation in the gut. So it's just not the food, but then now we talk about exercise, which also has a beneficial effect. So, our Western diet, what you see on the right of the slide, is if you look at a pyramid and it's inverted, that's the kind of diet we have. Everything at the top is all the things like the high carbohydrate things, highly processed things like that. that we may eat. In the middle are some other things like refined grains, potatoes, dairy, etc., pasta. And then at the bottom is all the fruits and vegetables and things that we should be eating in much more abundance. And so the Mediterranean diet is a pyramid pointed in the right direction. There you have the smallest amount of things such as sweets, high carbohydrate, refined products, processed meat, etc. In the middle, you have lots of things such as nuts, seeds, legumes, seafood, poultry, those kinds of things. And then at the bottom of the pyramid, the biggest part is whole grains, vegetables, fruits, etc. So that constitutes the Mediterranean diet. Well, I want to then share with you another kind of diet. It's the MIND diet, and you might have heard about this. It really stands for Mediterranean Diet Intervention for Neurodegenerative Delay. That's a mouthful, and that's why we call it the MIND diet. And so and this was specifically designed to maximize brain health. This diet uses really a combination of the Mediterranean diet we just talked about and the DASH diet, which has been around for decades, which has limited sodium intake and also has healthy foods. So the MIND diet emphasizes, there's a few things that are different from the Mediterranean diet. One of them is that although the Mediterranean diet advocates the use of olive oil, for example, the MIND diet emphasizes only use of olive oil for all kinds of cooking. And it and also talks about the generous amounts of intake of berries, several servings of beans a week, poultry a couple of times a week, having a couple of servings of fish a week. So this is kind of on top of the regular Mediterranean diet. So the Mediterranean diet is really the best overall for overall health, but the studies seem to suggest that the MIND diet may be the best to decrease cognitive decline. Okay, so we've covered a number of things so far. Is that we've talked about the essential ingredients of brain health, and so we've talked about the importance of exercise. We've talked about the importance of managing stress. We've talked about the importance of managing inflammation, and especially particularly through our diet just now. Some of us pride ourselves in how little sleep we need to function, but that's maybe at the price of bringing on worsening disease. Memories are consolidated during sleep, and a good night's rest not only helps you stay more focused in order during the day, is that, as I said, it consolidates memories. So as we age, unfortunately, the quality of our sleep and the amount of sleep we get is lessened. So we have to, as we age, we have to make an even greater effort to get the adequate amount of sleep we need. Unfortunately, many people turn to things that maybe, in fact, can be harmful, such as over-the-counter or prescription sleep medications, especially if you take it for a longer period of time. So sleep aids such as that contain diphenhydramine, that's Benadryl. But that Benadryl diphenhydramine compound is in a variety of over-the-counter products that such as Z-Coil, Tylenol PM, Advil PM, etc. And they're made to seem so harmless. They're very prominently displayed in racks, in stores, and we're made to think, well, this is pretty natural. Just if you have problems with sleep, just take this. But these products have anticholinergic properties, and which may increase the risk of dementia with long-term use. So anticholinergic agents block acetylcholine, which is an important substance associated with transmission of messages within the nervous system. So sleep medications can, besides that, the other problem is that the sleep medications can increase our risk of falls by almost 50%. So in a large study of seniors on the long-term use of anticholinergic medications, there was up to 30% increased risk for dementia. And sleep disturbance also causes an increase in inflammation. So we're going back to the inflammation before that we talked about, and how all these things are connected, and which can then cause a variety of health conditions, as we mentioned before. The other thing to keep in mind is that if you have sleep apnea, it's very important to treat it, because untreated obstructive sleep apnea can also impact cognitive functioning. The American Academy of Sleep Medicine recommends 7 or more hours of sleep for adults. And if you're a blissful baby like the picture, you need even more. And the American Heart Association has added sleep as one of the 8 essential ingredients for heart health. And so we've already talked about its importance for brain health, but of course also for heart health. And only about 1 in 3 of us really gets enough sleep. I mean, 1 in 3 doesn't get enough sleep. So, and for our purposes, it not only increases the risk of diabetes, obesity, and those other things, is that it does increase the risk for dementia. One of the other 8 the essential ingredients for brain health is staying mentally active. And so there's a lot of brain activity that happens when we engage with others in a social context, reading social cues, responding to that person appropriately. This brain activity enhances neural connections within the brain. And additionally, loneliness and feeling isolated has been shown to increase the risk of dementia. So meeting new people, etc., staying connected socially, even if it's family and events and things like that, that can be very important for brain health. The other thing that is important is a kind of a habit of lifelong learning. And I mean, studies indicate that the greater educational attainment does help, but it's not only that. So, I mean, it does help to have a PhD, but in some ways. But the thing is that but even if you have a high school, if you're a high school graduate, the fact is that I think about my mother. She reads constantly. And I just have to give her more and more stuff to read, because she just does that throughout the day. And so that's the kind of habit that you can develop. I mean, you can certainly do crossword puzzles or Sudoku, or even might enjoy, if you want, to play video games with your children or grandchildren. So those can be stimulating to you. Learning a new language especially can be beneficial, or a musical instrument, or I mean, you might have played the clarinet when you were in school, but it's you've never picked that up again, and those kinds of things can be really helpful. Now, if you're working, if you're still working, that allows you to stay mentally active. Imagine all the brain activity that goes into keeping your supervisor happy. So that in itself, working can be helpful. Right. So we're going to talk about the importance of maintaining good mental health for our brain health. And so one of the things that can increase the risk of dementia is untreated depression. And depression, unfortunately, comes in guises that fools us. it can come across as some of the problems that happen with aging and with cognitive decline, such as poor concentration, not being able to remember things, having difficulty making decisions, like not wanting to do things, poor motivation. All these could be kind of confused with the common problems associated with aging. Things such as poor appetite, weight loss, not having interest in things, sometimes can be attributed to the dwindles of aging, but really could actually be some of the signs of depression. So, and then with time, we lose more loved ones, have more medical issues, etc. And so people attribute sometimes the sadness we may feel, etc., to that, when actually these may be symptoms of depression. So now I'm going to talk about things that are what I call no-brainers, things we know, but things we sometimes have difficulty putting into practice. For example, keeping a healthy weight, especially in middle age, can reduce the risk of dementia later in life. The kind of weight that's especially problematic and harmful is the central obesity, the kind of the weight around the gut, the abdomen. That kind of weight around the middle is often associated with diabetes and heart disease, which can then in turn increase dementia risk. So a study of women in their 60s found that individuals that were those individuals that were obese had lower brain volumes and had accelerated aging by almost a decade. Imagine that. Smoking, another no-brainer. Increasingly less people smoke, but there are still some people that smoke, and it's one of the hardest habits to break. And I think it was Twain that was supposed to have said something like, "Quitting smoking is the easiest thing in the world. I've done it 1,000 times." So, but by quitting smoking, we also improve our cognition and our chance of decreasing dementia risk. Now, alcoholism is a known risk for dementia, but how much is safe to drink? That's a common question. And the reason that people get confused about that is that some of the studies are conflicting. Some studies suggest that moderate drinking, 2 or less drinks per day for a man and less than 1 drink a day for a woman, are reduces the risk for dementia. But a recent large study called that into question, saying that no amount of alcohol is entirely safe. Now, if you don't drink, don't start. But if you do drink, drink moderately. Since the jury's out, we don't know where things are going to land here. Now, things such as blood pressure, even a mild amount of elevated blood pressure can increase your risk of dementia by 30%. So, and there's additional good news here, because there are some of the medications that are used to treat blood pressure actually act on the angiotensin II receptor. And so they are, they actually have some protective effect in terms of dementia. And it's thought that possibly they may increase blood flow to the brain. And also importantly, make sure that you protect your head. Head injuries are risk for developing dementia later in life. So whether that's from falls, if you're elderly, from sports injuries, car accidents, whatever. So I'm going to talk about one more thing, which is part of the essential ingredients for brain health. And that's addressing a hearing impairment and vision impairment. In a study of older adults with moderate to severe hearing loss, those whose hearing was corrected with hearing aids decreased their chance of dementia by 32%. So not being able to hear, of course, causes social isolation, which in itself is a risk for dementia. We just talked about social connectedness and the importance of that. And imagine not being able to hear and being disconnected. I just speak from personal experience. My mother is going through this right now, where she's having a difficulty hearing, and before she used to be so sharp, and when she used to go to the doctor, she had a list of questions. She could, rattle off everything, and she still is sharp, but she can't hear. So the thing is that she's missing some of the things, for example, when she goes to doctor's appointments. And so I have to be there for her to be able to just relay what the doctor has said, and for her to be able to communicate more effectively with the doctor. And like a lot of older people, she refuses to wear a hearing aid. I've been working on her about that and telling her about the risk that she faces in terms of cognitive impairment as a result of hearing loss. Now, the other thing is that as we get older, our ability to focus attention is also reduced. Not so much for like an individual task, like a one task. Usually we can persevere. It takes us a little longer, but we can persevere and get that task done and pay attention to it. But it's multitasking, switching from one task to another, that is quite difficult as you age. And so, compound that difficulty with attention with the fact that by 80, 70% of individuals have some kind of hearing loss. And so impaired vision, impaired hearing, more difficulty focusing and paying attention with age. All these things are kind of like are ones that can impact you becoming more socially isolated and impact your risk for dementia. Okay, so we're going to talk about what's normal and what's not normal. What kinds of problems are normal memory kinds of issues or mental kind of functioning issues, and what is not normal? Forgetting something and then remembering it later. Like, for example, the example I gave at the top of the presentation about me forgetting a common word. When I was talking to my son, I was able to remember it later on. So that's fairly normal. Dementia is where you may be told something now, and then 5 minutes later you might forget it, or may have to be reminded again, or 10 minutes later. I know somebody right now who's one of our relatives that is experiencing some of this kind of stuff, where having some difficulty kind of remembering that. So now we can, part of what's normal is also making small mistakes. For example, if we're trying to balance a checkbook and don't do it quite right, that may be just part of what's normal aging, etc. But not being able to manage your budget at all, or completely losing track of finances, need somebody else to take care of your finances, that's not normal. Coming home from work and putting your wallet someplace, and that's not typical for you, and misplacing is fairly common, but putting your wallet in the refrigerator is not normal. I'm going to go through this fairly quickly. There's, of course, the cognitive spectrum of things, from normal forgetfulness with aging, mild cognitive impairment or MCI, and then dementia. With normal forgetfulness, recent memory is generally not impaired, in the sense that we will, and if it is, it's temporary and it comes back. And we're pretty functional in terms of our everyday tasks that we do. And in fact, people with normal kind of age-related memory, going back to the example of me not remembering that word, like it was on the tip of my tongue, but I couldn't remember it, I was more concerned about it. And usually people that actually have true cognitive impairment, in fact, they're not so concerned about it. It's usually family members Often people with the beginnings of dementia, etc., it's family members that bring them into treatment because they're worried about their memory loss. And mild cognitive impairment is more impairment in terms of mental functioning, but still with the preservation of everyday tasks. With dementia, it's the impairment in carrying out everyday tasks that's difficult, whether it's managing a budget, being able to, for example, drive, things like that. So MCI again is mild cognitive impairment, and this is something. There are two types. There's the amnestic type and the non-amnestic type. That the amnestic type is the one with more memory impairment, as opposed to executive functioning impairment, and that one is more linked to progressing to Alzheimer's disease. So it's important that if you do have some of the beginnings of that, to have regular follow-up with healthcare practitioners to track that. So we're going to talk briefly about the different kinds of dementias, and Alzheimer's disease is the most common type of dementia. And as you know, that involves amyloid plaques and neurofibrillary tangles, et cetera, that spread then throughout the brain that cause the disease. There is a hereditary component, in the sense that if you have a parent or sibling with Alzheimer's disease, that increases your risk for the disorder. Other kinds of dementias are vascular dementias, strokes, mini strokes, etc., may bring this on, and it can come on suddenly or more gradually, depending on the cause. Other dementias, such as dementia with Lewy bodies, with some Parkinson type symptoms, visual hallucinations, frontotemporal dementia, often can be confusing, and it's confused as psychiatric illness with behavioral disturbance, personality changes, etc. And then, about a third of our individuals with Parkinson's may develop dementia. Okay. So we've covered a fair amount of ground in terms of the things that impact our brain health and the things that we can do about it. Some kinds of the difference between normal and abnormal cognitive impairment. And now we're going to talk about meditation and mindfulness, because these are two powerful things that we also have under our control, that we can learn if we're not doing it already, that can decrease our risk for dementia and improve our learning and memory. In fact, there was study of subjects engaged in mindfulness-based stress reduction, and that showed an increase in the gray matter volume in the brain, which was associated with learning and memory. So taking those 5 deep breaths that we did in the beginning, that's a way to invoke the relaxation response. Another way to do that is meditation. And ideally, sitting 15 to 20 minutes, once in the morning, once in the evening, if possible, has the most robust benefits. But even an irregular practice has some short-term benefits, just like we saw with those 5 breaths. At least, I give you an example. There was one time on my smartwatch, I saw that, my heart rate was 100. And then I did those 5 breaths, and it came down to 80, just within like a minute or two. So, okay. Many benefits of meditation. You can see that here. I'm not going to go down the list, but for our purposes, it also improves cognition. Okay, so we use the word mindfulness is used so much. Sometimes we're not entirely sure what it means, but let me put it in a very kind of succinct way. Mindfulness is awareness. It's the opposite of forgetfulness. So even if we don't have time for any kind of sitting meditation, we can bring mindfulness awareness in our everyday activities. For example, driving to work. Most of us do this mindlessly, not mindfully. You're mindlessly thinking about, well, what you're going to be doing at work. You might be thinking about what you're going to do after work with the kids, some other project that you're working on, or worried about that MRI that you have to get later on in the month, and wondering what that's going to show. These kinds of things, that's kind of what we usually do. But mindfully bringing that would be, kind of just, looking at the trees, how the foliage has changed, looking at the clouds that are there, still paying attention to the road, and driving that way to work would be an entirely different experience. Okay, and there are many benefits of mindfulness, but what I want to highlight here is that it can enhance memory and attention. So here, the key takeaways. So that I want you to keep in mind here as we come to the end of this presentation is that what's good for the body is good for the brain. What's good for the heart is also good for the brain. So that's why things that we, for example, exercise, which is good for the body, is good for the brain. A healthy diet, reducing stress, etc., which is good for the heart, is also good for the brain. What we eat and how we sleep affects our brain health. How we manage stress, as we talked about, affects our brain health. And lifelong learning, social connections, that also improves brain health. No-brainer things like maintaining a healthy weight, treating medical conditions that we have, any mental health kinds of issues that we have, all of these improve brain health. And then also mindfulness and meditation can improve cognition, memory, and attention on various levels, including the fact that it can reduce stress, which then reduces inflammation and things like that. So I know that we're coming near the we're have a few minutes left, and so what I'd like to do at this point is that just take a few minutes for a guided mindfulness meditation. I'm going to cut the mindfulness meditation short so that we have a few minutes for Q&A. But here's what I want you to do. So if you're ready, I want you to now sit comfortably in the chair or wherever you are, and relaxed but upright posture, feet flat on the floor, arms resting gently in your lap. And if you feel comfortable, you can gently close your eyes or keep them half open. Notice how the support of the chair on your back, and now begin to slowly notice your breathing. So notice how the belly gently rises on the inhalation, falls on the exhalation. Or you may notice the air moving in and out of your nostrils. You may begin to notice some of the noises in the air, or the feeling of some breeze on your face. Following the breath brings up a natural relaxation response. Breathing in, I relax. Breathing out, I am calm. Much of our suffering is due to the thinking about past regrets and future worries. So when we breathe consciously, we bring ourselves into the present moment, which is really the only thing that exists. Thoughts come in and out of our awareness. This is natural. When you notice thoughts, let them float by like clouds in the sky, and then bring your attention back to the breath. Where is your mind right now? Bring it back to the breath. Become aware of the full extent of your inhalation and the full extent of your exhalation. Now, as we bring an end to this short meditation exercise, become more aware of your surroundings. Again, become more aware than any kind of noises that may be in the atmosphere. Feeling your body, bringing your awareness back to the body. Taking a few deep breaths if you want, just kind of as a nice ending. And then when you're ready, you can open your eyes if they were closed. So anyway, so this mindfulness meditation exercise is a way of bringing non-judgmental awareness into to our day. And the one advantage is that it's rather straightforward and you don't need necessarily a teacher to teach you this. So thank you for your attention to this presentation today. And then I'm ready to take any, if there are any questions, happy to
I have a
try to
question.
answer them.
Allow me. I have a question.
Sure,
First,
go ahead.
what can I? First question, is listening to a book as beneficial as reading?
That's a good question. I don't know the answer to that question. I think the thing is that if it is something that you're focusing attention on carefully, I think the thing is, and the thing I would say would be difficult sometimes with an audiobook is that you can end up doing, at least I do when I do audiobooks, I tend to multitask a little bit and kind of drift off. Which I don't do as much when I read a book. So I don't know the answer to that question, but I think that that will be one of the things with an audiobook that you might not get as much out of it if you're not really staying focused. Like a lot of people do driving and reading an audiobook. I mean, listening to an audiobook. So that might be not as good. That's a guess on my part.
Thank you. Another question. Do you know anything about these two substances to help against preventing dementia? Ginkgo biloba and lion's mane mushrooms.
Okay, so natural products, so-called, we don't have any really evidence-based, strong evidence-based to suggest things such as that because when we're talking about things such as dementia, even some of our best medications have a modest effect that have been FDA approved with double-blind trials, et cetera. So these are things that have not gone through rigorous testing as some of the medications that we have. So I think the important thing to also remember is that buyer beware, in the sense that many natural kinds of products can say whatever they want on the label, as long as they say that it doesn't treat a disease. It can say improves brain health. Well, what does improving brain health mean? It's not telling you, it's not saying that it cures mild cognitive impairment. It's not going to say that it cures dementia. So they can use words that actually are allowable, and there are nothing that the FDA or regulatory bodies can do about that kind of claims that are made.
Thank you. And the last question, Tai Chi, is it beneficial as yoga or not?
So, great question. Both are beneficial. What Tai Chi is especially beneficial for is the fact that that kind of choreographed slow movements, etc., are actually very beneficial in terms of helping with stability and decreasing the chance of falls, which is a major risk for the elderly, and which can then increase the rate, head injury and then dementia. So I would say Tai Chi is a very good thing to engage in. I don't know of any head-to-head studies with yoga and Tai Chi, but both of them are ones that I highly recommend.
Thank you. Thank you very much.
And just a reminder that you can ask a question, or you can type it into the chat box. We do have one online question. If someone is already in cognitive decline, can it be reversed, stopped, or slowed?
Yeah. So the thing is that it can be slowed. There are things such as mild cognitive impairment it may not progress further. And so the thing is that, and reversing it, I think that, I would be less sure that we would be able to reverse it, but we can definitely slow it. And in many cases, it doesn't progress further. So there's a certain percentage that does progress, but not all cases of that kind of impairment progresses.
And I see one other question. How do you determine if someone has dementia, Alzheimer's, or something else? What type of tests do you do to diagnose these conditions?
Yes. Okay. So there are certain simple kind of tests that many, whether it's a neurologist or a psychiatrist or a primary care physician uses in terms of people who complain with memory issues. And so the thing is that one of the common ones that we use is the mini mental status exam. That is one. MMSE is one we use. We also use the Montreal Cognitive Assessment, MoCA. That's another test that we use. These are both tests that can be done in 5-10 minutes. I just did one earlier today in my office with a woman, and I did the MoCA on her. She was worried about concentration, memory, processing, and I knew from the clinical interview with her that it didn't seem like she had any significant impairment, but it was very helpful for her to see a paper, something that was tangible that I could give a score. And I say, you scored 29 out of 30, you did great, and so she was reassured.
And we have another question. Does the white and gray space on a CT scan relate to dementia?
I'm not an expert on this, and so I don't think I don't want to make a guess that's incorrect about that. I think that's a good question for a neurologist to answer with that. But certainly, MRIs can be indicative of Alzheimer's, but usually the diagnosis, for example, of dementia is a clinical one. And many people have changes that are there, but don't have any significant clinical impact from them.
Another question, what is your opinion on lecanemab, the new drug approved by the FDA for the slowing the progression of Alzheimer's? Has the drug been studied long enough to make such claims?
I think the thing is that it's early innings for that. There are side effects to these medications, and that I think that, let me put it this way: if I had a family member that was going through, having dementia, et cetera, and I'd certainly ask the doctor about it. But I think the thing is that there are side effects and issues that so far, I think people are being cautious about it at this point.
One other question is, I suspect my mother has the early stages of dementia. Who do I connect with to determine? Should I contact my primary doctor or a specialist?
Well, if you are, I would, primary care physicians are very good at trying to diagnose or give an indication whether a person has dementia, and that's where I would go. If the primary care physician, because they deal with this very often, because they have a lot of elderly people, and this is a common question. So I would go to the primary care physician. If the primary care physician says, see a neurologist or get some neuropsychological testing done, I would go, to the next step, depending on what the primary care says.
And we've got another great question. Having never learned how to meditate formally, I find woodland hiking to be a mindful experience. Would that be an equivalent experience as far as benefits?
Yeah, what you're doing is essentially a mindfulness kind of meditation. It's a walking meditation is what you're doing. And so you can do a walking meditation, and it definitely has benefits. So if that's what works for you, do that. You don't have to do a sitting meditation per se. I think that and being out in nature is in itself a very positive thing. You're also exercising. You're doing a number of great things. So I say keep doing it.